What is menopause? How to recognize its symptoms. When to see a doctor. Menopause is the time that marks the end of your menstrual cycles. It's diagnosed after you've gone 12 months without a menstrual period. Happen in your 40s or 50s, but the average age is 51 in the United States. Menopause is a natural biological process. But the physical symptoms, such as hot flashes, and emotional symptoms of menopause may disrupt your sleep, lower your energy or affect emotional health. There are many effective treatments available, from lifestyle adjustments to hormone therapy. Symptoms. In the months or years leading up to menopause, perimenopause, you might experience these signs and symptoms. Irregular periods. Vaginal dryness. Hot flashes. Chills. Night sweats. Sleep problems. Mood changes. Weight gain and slowed metabolism. Thinning hair and dry skin. Loss of breast fullness. Signs and symptoms, including changes in menstruation, can vary among women. Most likely, you'll experience some irregularity in your periods before they end. Skipping periods during perimenopause is common and expected. Often, menstrual periods will skip a month and return, or skip several months and then start monthly cycles again for a few months. Periods also tend to happen on shorter cycles, so they are closer together. Despite irregular periods, pregnancy is possible. If you've skipped a period but aren't sure you've started the menopausal transition, consider a pregnancy test. When to see a doctor. Keep up with regular visits with your doctor for preventive health care and any medical concerns. Continue getting these appointments during and after menopause. Preventive health care as you age may include recommended health screening tests, such as colonoscopy, mammography and triglyceride screening. Your doctor might recommend other tests and exams, too, including thyroid testing if suggested by your history, and breast and pelvic exams. Always seek medical advice if you have bleeding from your vagina after menopause. Causes. Menopause can result from naturally declining reproductive hormones. As you approach your late 30s, your ovaries start making less estrogen and progesterone, the hormones that regulate menstruation, and your fertility declines. In your 40s, your menstrual periods may become longer or shorter, heavier or lighter, and more or less frequent, until eventually, on average, by age 51, your ovaries stop releasing eggs, and you have no more periods. Surgery that removes the ovaries, oophorectomy. Your ovaries produce hormones, including estrogen and progesterone, that regulate the menstrual cycle. Surgery to remove your ovaries causes immediate menopause. Your periods stop, and you're likely to have hot flashes and experience other menopausal signs and symptoms. Signs and symptoms can be severe, as hormonal changes occur abruptly rather than gradually over several years. Surgery that removes your uterus but not your ovaries, hysterectomy, usually doesn't cause immediate menopause. Although you no longer have periods, your ovaries still release eggs and produce estrogen and progesterone. Chemotherapy and radiation therapy. These cancer therapies can induce menopause, causing symptoms such as hot flashes during or shortly after the course of treatment. The halt to menstruation, and fertility, is not always permanent following chemotherapy, so birth control measures may still be desired. Radiation therapy only affects ovarian function if radiation is directed at the ovaries. Radiation therapy to other parts of the body, such as breast tissue or the head and neck, won't affect menopause. Primary ovarian insufficiency. About 1% of women experience menopause before age 40, premature menopause. Premature menopause may result from the failure of your ovaries to produce normal levels of reproductive hormones, primary ovarian insufficiency, which can stem from genetic factors or autoimmune disease. But often no cause of premature menopause can be found. For these women, hormone therapy is typically recommended at least until the natural age of menopause in order to protect the brain, heart and bones. Reference: mayoclinic.org. Thank you for watching the video. Please like, subscribe and share to my channel. Medicine Guide.